Welcome back to AdComfides TV. Here is the part 2 of the topic we started. What an ulcer is. Its types and symptoms. If you have not been following me, click on the blue button and follow AdComfides to get notifications whenever I upload any video. Now let's get into the topic. What is an ulcer once again? An ulcer is a sore or open wound that forms on the skin or mucous membranes of the body. In the context of medical conditions, the term ulcer. Causes of ulcers. The causes of ulcers vary depending on the type of ulcer. 1. Peptic ulcers. Helicobacter pylori infection. A bacterial infection is the most common cause of peptic ulcers. The bacteria damage the protective mucous lining of the stomach or duodenum, allowing stomach acid to create an ulcer. Nonsteroidal anti-inflammatory drugs. NSAIDs. Long-term use of NSAIDs, such as ibuprofen and aspirin, can irritate the stomach lining and lead to ulcers. Excessive alcohol consumption. Drinking alcohol can irritate and erode the stomach lining, contributing to ulcer formation. Smoking. Smoking increases the production of stomach acid and impairs the healing of existing ulcers. Stress. While stress alone doesn't directly cause ulcers, it can exacerbate existing ones, especially in individuals already predisposed. 2. Skin ulcers. Poor circulation. Conditions like chronic venous insufficiency, peripheral artery disease, or heart failure can impair blood flow to the skin, leading to skin ulcers. Diabetes. High blood sugar levels can impair blood circulation and nerve function, which makes the skin more susceptible to infections and ulcers. Infections. Some infections, such as cellulitis, can lead to the formation of skin ulcers. Pressure or trauma. Prolonged pressure, as seen in bedridden patients, or injury to the skin can cause open wounds that become ulcers. 3. Mouth ulcers. Trauma. Biting the inside of the cheek or brushing the teeth too hard can lead to canker sores. Infections. Viral infections, like herpes simplex virus, cold sores can cause oral ulcers. Stress and hormonal changes. Both psychological stress and hormonal changes can contribute to the development of mouth ulcers. Diagnosis of ulcers. 1. Peptic ulcers. Endoscopy. A procedure where a flexible tube with a camera is inserted into the stomach or duodenum to check for ulcers. 2. Skin ulcers. Physical examination. A doctor will inspect the wound and assess its appearance, depth, and signs of infection. Blood tests. These can help identify underlying health conditions, such as diabetes or poor circulation. Wound culture. A sample from the ulcer may be taken to check for infection. 3. Mouth ulcers. Clinical examination. A dentist or doctor will examine the mouth and may ask about the frequency of the ulcers, potential triggers, and medical history. See you in the next video for the last part. Till I see you in my next video, stay strong and stay healthy.